We are going to start tonight with Ebola, not because I want to scare you or sensationalize a scary-sounding virus, quite the opposite. I want to help you understand what feels like a rising tide of headlines about Ebola in the Democratic Republic of Congo, a country more than 900,000 square miles, which makes it the second largest on the African continent. The size of that landmass matters when assessing Ebola risks. We'll have more on that in a moment. Here is where things stand. 139 suspected deaths, 600 suspected cases. Suspected is the operative word here because surveillance is behind the curve and containment possibly has been broken with travel outside of the hot zones in the eastern Congo. The Congo, we should remind ourselves, is a poor country. 80% of its population categorized as impoverished. There are armed conflicts in the same part of the country where Ebola is now spreading. This makes healthcare delivery extremely difficult. Another complication? Modern medicine and its interventions in cases like this can sometimes trample on local customs, such as washing dead bodies as part of a burial rite or an elaborate funeral. And it is precisely that kind of close contact, the washing of bodies, elaborate burial ceremonies, that can spread Ebola generally and this Ebola virus in particular, a virus that we should note does not have a vaccine. And today this conflict, modern medicine, local customs, led a mob to burn an Ebola treatment facility. That mob was trying to retrieve a body, an apparent victim of Ebola. Aid workers fled the scene in panic. And you no doubt heard about the Air France flight scheduled to land in Detroit but diverted to Montreal because the passenger on board had been in the Congo. It was not known if this passenger had any symptoms or when this person was in the Congo. The United States is now refusing entry to any passenger without a U.S. passport who has been in the Congo, Uganda, or South Sudan in the past 3 weeks. So how much will all of this help? Also, U.S. passport holders from these three countries will now be diverted to one U.S. airport, Dulles, in suburban Washington, D.C. For more on all of this, I want to bring in CBS News medical correspondent Dr. Céline Gounder, and helpfully for this conversation, she's an infectious disease specialist who spent time in Guinea as an Ebola aid worker during the West African epidemic. Dr. Gounder, you heard my opening monologue about this. Help my audience understand where we are and, importantly, the size of the Congo as a way to assess cumulative or understandable risks.
So the DRC, the Congo, is about as big as Western Europe. It's a massive country in Central Africa, but it's also very difficult to travel long distances, and that's part of the challenge that we're seeing right now. This is also an outbreak that is occurring along the eastern border of the DRC, next to Uganda, where there have been a couple cases, and also South Sudan, where you have large refugee populations. And there are some suspected cases now in South Sudan, as well as we had heard earlier today, Kenya. The rate at which cases are, this has many of the same factors that led to the huge outbreak, the largest outbreak epidemic we've ever seen of Ebola, which was in West Africa, 2014 to 2016, which is when I worked there. So what are some of those factors? It's the fact that you're seeing Ebola in urban areas, not just rural areas. The fact that you're seeing cross-border spread, the fact that you have these mobile populations. In the case of this current outbreak, you have a lot of mining that occurs in this area, and it's not just gold mining, it's also mining for minerals that are used in your smartphones, in your EVs, and other modern technology. On top of that, you have Rwandan-backed militia groups, M23, which have been trying to essentially control the minerals, the mining. And the combination of the presence of that armed militia on top of USAID, so Americans having pulled out from the region, has led to the collapse of health systems, including supplies, so personal protective equipment, things like your gowns, gloves, masks, that supply chain has also collapsed, and there's a real shortage of those things, which is leading to healthcare workers getting infected, and then also pharmaceutical treatment. So it's an extremely challenging situation that people are dealing with on the ground. And
Right.
then
And
layer on top of that issues of trust. And I think people in the US,
Dr. Gounder, we're having a little bit of
I think people
connectivity
in the US will
issues.
be familiar with some. Let me,
I,
maybe I can go off camera if that's better.
uh, let's just try to muscle our way through this for one more question, Dr. Gounder. All the things that you said
Okay.
that are creating
Yeah.
complications and difficulties, what do you think we should look for in the next, let's say, week or so in terms of headlines or things letting us get a glimpse of whether or not this is being contained or whether or not it's spreading at an alarming rate?
Do we see more spread over borders? Do we see more healthcare workers getting infected? And at what rate do we see people getting exposed and new cases being diagnosed? I think that's going to be really important. The other thing, and I think people will understand this from COVID, trust is everything. And the fact that we've already seen Ebola treatment unit being set on fire, this was at Wampara Hospital, that we're seeing again resistance to isolation. And I think people here will understand not wanting to mask, not wanting to get vaccinated, not wanting to stay at home if they're sick. It's very similar kinds of behavior that you're seeing in this context. How do you bridge that trust gap and get people to cooperate with health officials, but to do so in a way that is compassionate and meets their needs as well?
Very quickly, because the connection's gotten so much better, I want to get one more question in, if possible, Dr. Gounder. What about these travel restrictions? How should we think about them? Are they helpful, or are they sending a sign that maybe alarms people more than is actually helpful?
I think the way to think about how to be worried, it's not worried about what's going to happen here in the US, it's worried about what's going to happen there. But that also means in order to contain it there, which is how we actually protect ourselves, we need to be able to surge a response there. And that means we need to be able to get healthcare workers in and out. The fact that the first American physician to have been infected, at least so far in this outbreak, was flown to Germany, not back to the US, even though we have the capacity, the facilities to care for them here. That is really concerning. A lot of people in my world who were thinking about volunteering to go are having second thoughts because they're worried, if I get sick, where am I going to end up? If I go over there, am I going to be allowed back in the country? And we saw issues with that back in 2014, controversies about travel bans back then, and that leads to a lot of hesitation, will make it harder to respond to this outbreak.
Dr. Céline Gounder, thank you very much. I appreciate it.